Hello, this is Dr. Patrick Hu from Moffitt Cancer Center. We're here today with Dr. Elsa Flores. Dr. Flores just got a $10.2 million grant from the National Cancer Institute for lung cancer. Dr. Flores, welcome.
Thank you.
Can you please tell me about this $10.2 million grant you got from the NCI?
Yeah, thanks for having me. I'm really excited to tell you about it. This is a PO1 or a program project grant, and it's awarded to the Lung Cancer Metabolism Working Group. We've been working together since early 2018, and the main goal was to bring together various subject matter experts and unify their research around this common theme of lung cancer and identifying metabolic pathways to develop targeted therapy. Each project primarily focuses on genes altered in lung cancer that are difficult to target therapeutically, and really to identify novel metabolic pathways that we can ultimately therapeutically target in lung cancer.
So tell me about genes. Some of them are termed druggable, some of them are undruggable. We want to drug them all, right? And help lung cancer patients. What's the difference between those two? And tell me, how are you making the undruggable targets more druggable?
Yeah. There's certain targets that are difficult to therapeutically target, and they are usually characterized or dubbed as undruggable. These targets are typically transcription factors, and many of the projects in the PO1 focus around transcription factors which are commonly mutated. And so the idea behind our project is to target metabolism, to really understand the pathways that are more specific to lung cancer cells, and then to develop compounds that specifically target these cells that have really been rewired to metabolically thrive.
What do you think the ultimate druggable situation will be for lung cancer with this, so that you can increase that specificity?
Yeah, I mean, you're absolutely right. Although it seems that some cancer cells have been known to hijack metabolic pathways in a way that some normal proliferating cells do not. So that's really exactly what we're trying to tackle, is building models. And so a lot of the grant focuses on preclinical models and really understanding pathways that are specifically used by lung cancer cells versus cells that are healthy and proliferating in other organs.
Do you think that you will then be able to find some things that can help other cancers besides lung cancer from this project?
Yeah, absolutely. I mean, we've seen this in a lot of what we do in the lab is understanding the function of the family members in basic epithelial cells. We actually have another project focus on stem cells in the lung cancer, and stem cells in the lung, and really trying to understand how these different genes regulate different cell types that are thought to be the cell of origin of lung cancer, for example. But a lot of these cells have overlapping functions in other epithelial cell types, such as in the breast and in the skin. And so we do see a lot of overlapping mechanisms. So I think what we find here can be tested and applied in other cancers.
Dr. Flores, tell us about the use of machine learning in some of your cancer research.
One of the things that we're really trying to build here at Moffitt is better preclinical models that mimic human cancer. And so part of the grant is focused on developing speedy mouse models of lung cancer, where we can engineer in mutations quickly and maybe look at targets that we think might be targetable by a drug, but we want to check genetically whether the tumor will regress. So there's that novel aspect of the grant. And the other one is developing innovative diagnostic tools. And we're doing this using artificial intelligence. And I'm really excited about it because one of the limitations of studying mouse models is that, you rely on pathologists to tell you that, yeah, that looks like what we see in human cancer. No, you're way off target. And so we've teamed up with Terry Boyle and James Soller, who are pathologists in the thoracic group, to develop a machine learning algorithm to grade our mouse tumors. And in fact, it's so accurate that when we look at human tissue microarrays, we see similarities, and the machine can basically cannot tell whether it's mouse or human. So we're really excited about that technology because we think that as we're testing therapeutics and then we put it through this algorithm, we'll be able to learn new things about the tumor and different molecular pathways using machine learning tools.
Well, it sounds like a extremely important project that you have amassed a group of basic laboratory people working with the clinicians in lung cancer in this case, and bringing together a number of fields of molecular biology, metabolism, and immunology. So congratulations again on that. It sounds like it's very exciting, and we would love to have you back to talk about some of the findings of this grant as it gets going.
That would be great.